Hello, my name is Andrew Burgee, and I'm the Hazardous Materials Training Coordinator for the NYU School of Global Public Health's Hazardous Waste Worker Training Grant for our grantor, NIEHS. Welcome to our first of 5 modules, What is COVID-19 and its Symptoms for our Home Healthcare Workers. This module focuses on the origin and definition of COVID-19, its symptoms versus other infectious agents like the flu. SARS-CoV-2 is the virus that causes coronavirus disease 2019 or COVID-19. The virus that causes COVID-19 is a type of coronavirus, a large family of viruses. Coronaviruses are named for the crown-like spikes on their surface. Though coronaviruses are a large family of viruses that are common in people and many different species of animals, this coronavirus is a novel virus that has its origins in bats. According to the Center for Disease Control, or CDC, COVID-19 is a respiratory virus. Current symptoms have included mild to severe respiratory illnesses with fever, cough, and difficulty breathing. As expected, viruses constantly change through mutation, and new variants of a virus are expected to occur over time. Multiple variants of the virus that causes COVID-19 have been documented in the United States and globally during this pandemic. Please consult the CDC website for more detailed information. COVID-19 is thought to spread mainly through close contact from person to person, including between people who are physically near each other, usually within 6 feet. COVID-19 spread is from respiratory droplets and aerosols produced when an infected person sneezes or coughs, and these droplets and aerosols are inhaled by another person, spreading infection. It can also be spread through an asymptomatic infected person who is generating respiratory droplets through talking, singing, or breathing that are inhaled by another person, spreading the infection. Cases of reinfection with COVID-19 have been reported but remain rare. Those considered high risk include people over the age of 60, pregnant women, and anyone with an underlying health condition or a weakened immune system. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Cough, shortness of breath or difficulty breathing, fever or chills, muscles or body aches, vomiting or diarrhea, or new loss of taste or smell. This list does not include all possible symptoms. The CDC will continue to update this list as we learn more about the virus. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, pale, gray, or blue-colored skin, lips, or nail beds, depending on skin tone. This is not a list of all possible symptoms. Please call your medical provider for any other symptoms that may be severe or are concerning to you. Call 911 or call ahead of time to your emergency medical facility and notify the operator that you are seeking care for someone who has or may have COVID-19. COVID-19 and influenza or flu are both contagious respiratory illnesses. SARS-CoV-2 is the virus that causes coronavirus disease 2019 or COVID-19. Influenza is caused by infection with influenza virus. How easily a virus spreads from person to person can vary. The virus that causes COVID-19 appears to spread more efficiently than influenza, but not as efficiently as measles, which is among the most contagious viruses known to affect people. If a person has COVID-19, it could take them longer to develop symptoms than if they had the flu. Typically with the flu, a person develops symptoms anywhere from 1 to 4 days after infection. Typically with COVID-19, a person develops symptoms 5 days after being infected, but symptoms can appear as early as 2 days after infection or as late as 14 days after infection, and the time range can vary. Most people with flu are contagious for about 1 day before they show symptoms. Older children and adults with the flu appear to be most contagious during the initial 3 to 4 days of their illness, but they may remain contagious for about 7 days. Infants and people with weakened immune systems can be contagious with flu for even longer. With COVID, it is possible for people to spread the virus for about 2 days before experiencing signs or symptoms, and remain contagious for at least 10 days after signs or symptoms first appeared, even if the symptoms were never displayed or went away. Because COVID-19 and the flu share many symptoms, it can be difficult or even impossible to tell the difference between them based on the symptoms alone. Special tests that usually must be done within the first few days of illness can tell if the person has the flu or COVID-19. This is a mini quiz. Please answer each of the following 5 questions. A COVID-19 spreader must demonstrate observable symptoms to be contagious. True or false? Influenza, flu, and COVID-19 are both contagious respiratory illnesses caused by SARS-CoV-2. True or false? COVID-19 symptoms usually occur 2 to 14 days, 15 to 30 days. There is no pattern. Which takes longer to present symptoms? Flu or COVID-19? Testing is required to differentiate between COVID-19 and the flu. True or false? In conclusion, the SARS-CoV-2 is the virus that causes the coronavirus disease 2019 or COVID-19. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Cough, shortness of breath or difficulty breathing, fever or chills, muscles or body aches, vomiting or diarrhea, or new loss of taste or smell. This list does not include all possible symptoms. The CDC will continue to update this list as we learn more about the virus. Some emergency warning signs for COVID-19 are as follows. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, pale gray or blue colored skin, lips, or nail beds depending on the skin tone. This concludes the first module. Be safe and thank you for your time.